Here's a look at our top stories. Malawi launches new development vision with a call on its citizens to divorce themselves from trivia and help turn Malawi into a middle-income nation. Health experts warn excessive consumption of herbal elements against COVID-19 may pose a health risk. And a speeding truck crashes into pedestrians in Cheoboma, killing 7 people. Glad you could join us. Now the news in detail. Malawi has launched her long-term successor development plan to Vision 2020 with a call by President Dr. Lazarus Chakwera for people in the country to divorce themselves from trivia and help turn Malawi into a middle-income nation. Speaking when he launched Malawi 2063 at the Kamuzu Palace in Lilongwe, Dr. Chakwera added that collectiveness, selflessness and commitment are key for attainment of the aspirations in the new vision. Isaac Jali has a report.
Launching the development agenda virtually at the Kamuzu Palace in Lilongwe, President Dr. Lazarus Chakwera said Malawi has all it takes to achieve all the aspirations laid down in the blueprint. Dr. Chakwera said despite being endowed with freshwater, fertile land and mineral resources, it is sad that over the years the country has not prospered for lacking the ability to tap from one fundamental resource, the ingenuity of its people. The Malawi leader also spoke highly about the need to avoid wastefulness of time, money and land, but use these resources prudently.
We must remember that this is not just a vision for Malawi, but the vision of Malawians to be fulfilled by Malawians. In practice, this means that if we do not increase the socioeconomic capacity of Malawians over the next decade, we are not going to reach the 2063 shores we are setting ourselves for here. When we say that we want Malawi to be a wealthy and self-reliant nation, or that the pillars of our Vision 2063 are agricultural commercialization, smart urbanization, and sustainable industrialization, we must not imagine that these will come from the labors of another nation. The bottom line is that if we ourselves do not work hard, work smart, and work together, we will not succeed.
Earlier, the Vice President, who is also Minister responsible for economic planning, Dr. Saulos Chilima, said Malawi 2063 will be reviewed every 5 years to take stock of progress every sector will be making towards realizing the set goals.
Having learned from the past mistakes, the implementation framework of the MW 2063 seeks to remedy this defect through guiding principles that will include the following. Number 1, alignment of party manifestos to the vision, its pillars and enablers. Number 2, alignment of medium-term development plans and budgets to the vision. Number 3, a coordinated approach to implementation, which will include pillar and enabler coordination groups. 4, private sector active involvement in development. And number 5, deepening regional and global integration, among other principles. Consequently, implementing the vision requires and entails a review of the Political Parties Act, requiring that henceforth political party manifestos be aligned to the MW 2063 and avoid short-termism by political administrations.
In his remarks, Chairperson of the National Planning Commission, which will lead the implementation, Professor Richard Nkandawire, challenged youth to be key drivers of the development agenda. The Malawi 2063 will, among other things, be anchored on 3 pillars of agriculture commercialization, industrialization, and urbanization, as well as mining. The new vision focuses much on wealth creation as opposed to its predecessor Vision 2020, whose emphasis was poverty eradication. Vision 2020 was widely deemed by pundits as a failure in terms of delivery of development objectives set back in 1998. Isaac Jali, MBC, Lilongwe.
Students in boarding schools who test positive for COVID-19 will not be allowed to go home until they test negative for the coronavirus. This is according to Minister of Education Agnes Nyalonje. Speaking during a press briefing by the Presidential Task Force on COVID-19 in Lilongwe on Tuesday evening, the minister said the decision is aimed at ensuring that such students receive appropriate medical treatment while at school. She added the development is also aimed at ensuring that such students do not infect other people while in transit back home. During the briefing, Minister of Information Gospel Kazako emphasized on the need for everyone to strictly adhere to set prevention guidelines on the pandemic.
For students who test positive, they will not be allowed to go home until they are looked after in the school and they are certified to be okay. And I want to assure parents and guardians that the health officials working very closely with the school management will make sure that these young learners are looked after in isolation and are given the best possible support. And the task force, the Presidential Task Force on COVID, will do their best to support the schools to provide such care and attention. Let me explain that the reason for keeping these learners that have tested positive in schools, in boarding schools, is to protect them and make sure they are looked after well, and also to protect the families and the communities where these students come from.
Meanwhile, co-chairperson for the Presidential Task Force on COVID-19, Dr. John Puka, has disclosed that over 853 people have tested positive for the virus. The number is the highest since the outbreak was reported in April 2020. Dr. Puka added that in the last 24 hours, 15 people have died against 47 who have recovered from the pandemic. The Ministry of Health has gazetted new COVID-19 rules and regulations that are meant to prevent further spread of coronavirus in the country. Speaking at a media briefing in Lilongwe, Minister responsible Kumbize Chiponda said the country is in a crisis and the rules will help to minimize damage that has been caused so far. Thomas Piata reports.
Among other aspects, the rules make wearing of face masks in public mandatory and limits public gatherings to 50 people. Minister of Health Kumbize Chiponda was quick to say that anyone found violating the rules and regulations will face the law.
It is for these reasons that indeed we have gazetted new laws, and as I'm talking now, it is already law. So it means whoever contravenes, whoever doesn't abide by this law, they will be answerable to the powers be and those who are supposed to enforce the laws.
Speaking during the same briefing, Minister of Information Gospel Kazako insisted that if Malawians follow the guidelines, it will be easy to defeat the pandemic. Kazako also urged people that have tested positive for coronavirus not to despair, as a lot of people are recovering. The new regulations follow a directive from President Dr. Lazarus Chakwera to review the regulations so that they suit the current state of the pandemic. Thomas Piada, MBC, Lilongwe.
The second wave of COVID-19 has seen a lot of people consuming traditional remedies to boost immunity against contracting the virus. While it is contained in the country's COVID-19 guideline on home-based management of persons with asymptomatic and mild COVID-19, health experts have warned Malawians that excessive consumption of herbal elements may pose a health risk. As Alefa Kasongo reports, some people are taking the remedies based on what they heard on social media, an act that the COVID-19 guidance warns against.
Going around most markets in Malawi, it is easy to notice that ginger, lemons and garlic are selling like hotcakes. One of the products that has also hit markets are blue gum leaves. It is believed that inhaling hot steam from the leaves helps in dealing with COVID-19 symptoms. This reporter met Sipho Mwale at Zigwagwa Market in Mzuzu, who is now selling lemons and ginger on his bench on top of his Irish potato business. Mwale says he sells more lemons than ginger as compared to Irish potato. I then bumped into Deborah Maonga, a Mzuzu resident who was buying ginger and garlic for home remedy.
I'm a social media.
Deborah says she heard on social media that the natural substances are helpful in boosting immunity. Deborah says she's ready to take any remedy that is believed to be helpful in preventing COVID-19. Page 2 of the Malawi government guidance on home-based management of persons with asymptomatic and mild COVID-19 says it is not harmful to use traditional remedies like black seed, turmeric, ginger and other natural substances known for their anti-inflammatory properties. However, $1 million question one may ask is, what is the correct amount of consumption of such substances? Dr. John Chipolombwe, head of internal medicine from Mzuzu Central Hospital, is of the view that people must consume reasonable amount of the remedies or risk developing other health complications sooner or later.
The challenge which we have is how much of those people can take. I think previously, before this COVID, people were taking these ginger, lemons, whatever, to a level which can be accepted as consumables. But if, for example, those other elements are overtaken in overdose, what effect will be there? So maybe the thing which we have to make sure we resolve is let's use these elements, but we should not use them in excess. Anything which you have taken an overdose, it becomes poisonous. So we might end up suffering the effect of that.
The Malawi government guidance on home-based management of persons with asymptomatic and mild COVID-19 also warns against taking any medicines heard on social media, as many of such treatments have not been proven to work and some are reserved for seriously ill patients who are being treated in hospital. Other health reports from the internet indicate that high consumption of garlic can induce liver damage, lemons can cause mouth ulcers and gastroesophageal reflux disease, while excessive intake of ginger aggravates various health issues. For MBC News in Mzuzu, this is Alifa Kasongo reporting.
This is MBC News, a reminder of our top stories. Malawi launches new development vision with a call on its citizens to divorce themselves from trivia and help turn Malawi into a middle-income nation. Health experts warn excessive consumption of herbal elements against COVID-19 may pose a health risk. And a speeding truck crashes into pedestrians in Cheoboma, killing 7 people.
Your gums hurt?
Yeah.
Does your toothpaste contain sage, eucalyptus, myrrh, chamomile?
Oh, that in one toothpaste?
Yes, try Colgate Herbal. Colgate Herbal contains nature's best herbs and Colgate's fluoride technology to give you strong teeth and healthy gums.
Ah, Colgate Herbal.
Let's go. Colgate Herbal for strong teeth and healthy gums naturally.
Welcome back to MBC News. Now, a Blantyre Youth Centre has turned into a field treatment centre to ease congestion of COVID-19 patients at the main referral hospital, Queen Elizabeth, in Blantyre City. This follows a directive by President Dr. Lazarus Chakwera on Sunday. Blantyre Youth Centre, alongside Bingu National Stadium, Zomba State House, and a place in Mzuzu, were turned into field hospitals to increase admission space for people suffering from COVID-19. Austin Fukula visited the center to appreciate the state of preparedness at the facility.
Blantyre Youth Center, a place where the president directed that this place has to turn into an isolation center for COVID-19. As you can see in the picture, this place is being set to ensure that it accommodates people who are suffering from COVID-19.
As a field hospital, Blantyre Youth Center will have 300 beds to treat for COVID-19 critical patients. Work to turn the sports facility into a field hospital is gaining momentum. The place will be managed by the medical charity Medicine Sans Frontiers, MSF. The organization says it is working around the clock to ensure that the facility is operational and that in the initial stage it will start off with 40 beds, with the number increasing along the way. Head of mission for MSF in Malawi, Marion Pecha, says the medical charity has invested 1 million euros, which is about 937 million Malawi kwacha, to respond to COVID-19 situation, which has since overwhelmed Queen Elizabeth Central Hospital and the Blantyre District Health Office.
Currently, we're setting up this 42 beds intensive care unit. This could be increased to about 100 by multiplying this number of tents. You know, if we add up two of these, the same setup tents, we would reach about 100 beds. And then, you know, the flow of patients will make it so that, yes, I mean, the 300 patients will be able to go through in the coming weeks and months through this place.
The medical charity is providing personnel and medical equipment to handle COVID-19 cases at the Sports Tent Field Hospital. In an interview with MBC, Director for Health and Social Services for Blantyre, Dr. Kiftika Walasila, was quick to acknowledge the contribution by MSF, among other stakeholders, helping the hospital to deal with COVID-19. He said the treatment center will help to ease pressure at Queen's, which at the moment can only admit 80 COVID-19 patients.
From the figure that we're looking for, which is 300, medicines can actually support 40 beds. We currently have got 100 beds, 8 at Queen's and 20 at Kameza. So it means we're remaining with about 160 beds that need to be actually constructed. Medicines will also provide medical equipment for the 40-bed capacity ward. Medicines will also provide staff that will man the 40-bed capacity ward. So it means now government and other stakeholders have to come in and actually provide the remaining 160 bed ward.
According to officials from Medicine Sans Frontiers who are managing this particular facility, they are saying this place is going to be operational by the end of this particular week. Reporting for MBC, this is Austin Fukula.
A leading psychologist with College of Medicine has advised Malawians to stay positive in the face of rising cases of COVID-19 infections. In an interview with MBC, Dr. Chiwoza Bandawe admitted the pandemic is causing a lot of mental stress to people worldwide, leading to increasing cases of depression. He said locally, statistics show the majority of those infected are recovering from the disease, and therefore getting infected should not make one to lose heart.
The stress for those who are infected, I think the most important thing is to look at the outcomes that we have. If we look at yesterday's figures released by the Ministry of Health about the latest COVID figures, we do know that out of 13,027 confirmed cases, 6,080 have fully recovered. That's about 47%. Have fully recovered. We have lost 2%, about the 321, that's 2%. And yes, the loss of even one person is one too many. And for the bereaved family, it's a very painful and traumatic experience. We need to see the whole picture. So we need to recognize that the majority of people recover. The majority of people who do get COVID do recover. And so when one finds that they are going through COVID-19, it's very important to have that whole picture, to know that actually the chances of my recovery are higher than the chances of of my dying. And I think that is very important. The other thing is to understand the fears and the uncertainties of other people, because other people, it's a whole new virus. When something is new, people are unsettled and uncomfortable, and so they would rather avoid. And then another thing that's very important is to listen to the stories and the testimonies of those who have recovered. And I don't think there are enough of those stories going around. The 6,080 who have recovered, each one has a story, has a testimony to share, to tell. And we really need to encourage that so that people can hear that and can know that, yes, I went through, I'm going through this, but someone has gone through it and they have recovered. I think it's also important to recognize that we have all gone through challenges before. This one is a new one. It's something different. Humanity has never had it. But we have all navigated through challenges before. And so to remind ourselves of how did I overcome this challenge? What did I do to overcome the previous challenges I have been through, whatever they might be it social, be it economical, whatever it might be, but to remind yourself of what it was that enabled you to go through.
About 63% of COVID-19 patients in Mangochi have been reported to have recovered from the disease. Mangochi District Rapid Response Team Lead Stanley Rashid told NBC that although the disease is getting a lot of people scared, but a good number of people are recovering if they follow advice of health practitioners. Hassan Piri reports.
COVID-19 pandemic has become one of the diseases that is scaring people once tested positive. The fear is coming about because of media reports highlighting the number of people that are dying due to COVID-19. However, MBC spoke to one Benedicto Chambo, a member of parliament for Mangochi North, who was once tested positive, and he recovered, to find out from him how he recovered from a disease that has no cure at the moment. Chambo says he has been following what doctors were advising him, as well as doing steaming process using herbs such as ginger and lemons.
This made me also to survive. It's just a complication of a lot of trials that I was doing. But I can't say that this is the real medicine that cured me. But I had a lot of trials with different herbs, like in the neem, which every day I was doing it 3 times, in the morning, afternoon and the evening. According
to Mangochi District Hospital, about 293 people have tested positive, and out of that, 184 have recovered, representing 63% recovery rate. Mangochi District Rapid Response Team Lead Stanley Rashid encourages people not to be scared whenever they test positive of COVID-19. Rashid says at the moment the pandemic has no cure, and those that are recovering are following doctors' advice and exercising all preventive measures.
It is possible for someone to recover from COVID-19. As I can say, that out of 293, 184 have recovered, meaning 63% of them have recovered. So what is important is that people should follow preventive measures.
On steaming, Rashidi says there is no empirical evidence that steaming cures COVID-19. However, he says steaming using ginger and other herbs helps to boost the immune system.
There's no cure COVID-19. However, those that are drinking safe, maybe citrus fruits and what have you, maybe kwambiri, it's a matter of just to boost the immunity. But actually, the body fights off the infection on its own.
Malawi has registered over 13,000 cases, and so far over 6,000 have recovered. Hassan Piri, MBC News, Mangochi.
Now, a speeding truck has crashed into pedestrians at Ncheoboma, killing 7 people with others sustaining various degrees of injuries. Maisoji Kazula with the details.
The accident occurred on Monday at around 8 o'clock in the evening, involving a truck that was on its way from Dedza, heading for Balaka district. Upon arrival at Ncheoboma, the driver lost control and plunged into a group of 11 people. 7 people, who include the driver, have died. As police publicist Foncheu explains, the accident occurred after the driver of the truck lost control in the course of trying to avoid colliding with a motorcyclist.
The driver lost control of the vehicle just because he was trying to avoid a non-motorcyclist. So in the process of avoiding, he lost control of the vehicle and went to the extreme offside dirty vehicle where he hit 11 pedestrians.
Ncheu is prone to road accidents, as just last year the district recorded 115 road accidents, leading to the death of 76 people. The number of the accidents in question represents an 11% increase compared to the same time in 2019. According to Jigaru, there was need for collective action to help reduce rising cases of road accidents in the district.
Police, we are doing everything possible to try to arrest this situation because it's a known fact that indeed in jail we normally register a lot of accidents, not just the mere accidents but the first ones are tragic ones. So this is one of them, and this is the first of its kind. This normally we always call upon everyone, all stakeholders, including the pedestrians, the motorists, and the all road users to join hands with the police.
In a related development, a truck has crashed into a saloon vehicle in Lilongwe. Confirming the development is police publicist for Lilongwe Police, Foster Benjamin.
There was an accident this morning in which a truck slammed into a saloon whereby some people were seriously injured following that crash. The fact is that nobody else died following that accident. But as of now, the casualties are being treated at the Kamo Central Hospital.
Recent annual records for the Directorate of Road Traffic and Safety Services, DRTSS, indicate that road accidents are a matter of road safety concern in Malawi. In 2019, for example, the number of road accidents had almost doubled to about 10,000 from over 5,000 cases that were recorded in 2018. Maeso Chikadzula, MBC News, Lilongwe.
Well, that item wraps up this edition of MBC News. A reminder of our top stories. Malawi launches new development vision with a call on its citizens to divorce themselves from trivia and help turn Malawi into a middle-income nation. Health experts warn excessive consumption of herbal elements against COVID-19 may pose a health risk. And a speeding truck crashes into pedestrians in Cheoboma, killing 7 people. Well, for more news, visit mbc.mw. I'm Kumbukani Piri, and Aline Limponda was our sign language interpreter. Thanks for watching, and bye for now.
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate. One, wake up, wake up. 2, brush up, brush up. 3, smile through your day with a fresh breath and strong tea. Smile through your day with a fresh breath and strong tea. Do the 1, 2, 3 with Colgate and give yourself a future to smile about.
This is MBC.